rating system altogether.
Yes.
Dr. Summers, I would argue that your zinc and your vitamin D, et cetera, have been studied and they have not been shown to be effective.
Perhaps we should get Dr. Ryan Cole here to discuss that for everybody, because I think,
Well, there was just recently an article that took patients who were admitted to the hospital for COVID, they gave them vitamin D, no difference.
I believe the reason for the vitamin D is to stay up on it ahead of time.
Absolutely.
Yes, and
Absolutely.
are we telling people to do
No,
that? No, we
no.
never have.
Nope.
No,
I
Never.
disagree.
no.
If you go to a physician, I mean, that's one of the things I always talked about, was the data on vitamin D. It used to be 400 units a day was adequate.
Oh,
And
it's
now
not.
they're really saying probably 2,000.
More than
Some
that.
people say 5,000.
10,000.
Some people, like Dr. Fauci says, he takes 8,000 a day.
Right.
Right.
I can argue that, and I heard a gentleman from Harvard, that he said the only time you will get into trouble with vitamin D as far as too high levels is if you have hyperparathyroidism within 2 days of supplement.
Perhaps, but I think Dr. Cole has studied it extensively. But again, the numbers I just read are accurate. And so that's what we have. And there's no reason for us to continue this health order system when we could be doing better things with our time and money.
And we don't test
Amen.
COVID with petri dishes.
You can't find the virus. in
That's a
petri dish.
bacterial test, petri dishes.
Okay, so what do you test to find the bug?
That's what you
bacteria?
do with antibodies and the PCR testing.
PCR testing doesn't go to a petri dish
No,
and grow the bacteria.
no,
To find out whether or not you have an actual live bacteria that is actually.
it's not a bacteria, it's a virus.
Great, but you can still find it if you do a petri dish test, right?
It's not a
Perhaps
petri
I'm not-
dish.
Oh, what is it?
They put them in little test tubes.
And what's in the test
They aren't
tube?
growing the bacteria, are they, in those test tubes?
Again, this is a virus.
Okay.
This is
No,
this is not a bacteria.
When you
Viruses
go
can't be
in
found.
the petri dish to find out whether or not.
That's
you have
where you
enough
do the
live
polymerase
virus.
chain reaction and to amplify the DNA of the virus in the test tube.
Okay, well, I'm not gonna argue with you because maybe you don't have the proper terminology in my head, but
No,
nevertheless, I appreciate that, but nevertheless, these numbers are what they are. And this came from Health and Human Services. We have our 2019 emergency plan right off of this. And in fact, if you go back and read the governor's papers here, this is exactly what he went off of, despite what we got from your questions that you asked for me, Nikki, in the email from Health Law.
Very interesting to me too as well that the governor hasn't changed his stage, because we're below the numbers that we were when we left stage 4.
It's a scam.
And that's not our topic, but it is interesting to me. I don't know that, I would love to get rid of the health alert levels. I would commend Nikki and her team for putting together a plan that does that for us. Nikki and I chatted about that last month, and I, again, will commend her and the team for putting together a plan. I just would like, I think that the colors and the numbers, like percentages, are too low in each of those color categories. So for me, I like having a plan to find an exit plan, but looking at those, it's not too late to look at the percentages and make modifications. Specifically the death rates and the hospitalization rates.
Is there any more discussion on this? If not, then we probably ought to move on and see if we can move with the recommendation to the health alert level, or change it and ask for a different one that we can do a special meeting.
Commissioner Abbotsford, may I ask a clarifying question to Commissioner Smith?
Yes.
Thank you. You mentioned the hospitalization rates and the mortality rates, and that we just proposed changing those to help when we are looking at those data, that because because we're seeing so little testing, it you get 1 or 2 cases and it can throw it off. So we recognize that that's not gonna give us, a very good picture. We wanna use our data to make, good decisions and make adjustments as necessary. So are you suggesting that what we're proposing is sufficient, or are you suggesting that, you would like to do something different?
I think, your suggestions are a step in the right direction, but the only additional change would be to increase those numbers, slightly.
Like case number?
Yeah, so like,
cases per
like
day?
for example, the fatality rate in red matches orange, so maybe that should be 3% of COVID cases result in death. And then specifically on hospitalization rates, yellow should probably, so that there's a clear 6% or more than 5% up to 10% is yellow, and then more than 10% up to 15% is orange, and then the other one to look at is the number of new cases per day. I'd like to see increases in the allowed numbers there, that falls more in line with maybe pandemic status. Even though I think I could argue that we're in an endemic, I don't know that we are gonna, I don't know that COVID's going away. So.
Let's move on. Let's move on.
I'd
End
like
it.
to see those 3 changes at least.
End
And
it.
I will say for the record, after I had been participating on this board for 2 months, I can't believe how many elected officials had no idea that they could give input on the health alert levels. That was not something that anyone knew that they could do. They didn't know what the means to do that was. So it probably does need removed, but we probably should have been telling people that they did have a voice, and they didn't know it.
Yes. Yes. Good job.
So I think maybe, I know Commissioner Abstray wants to move the meeting along, but one, it sounds like we're gonna have a special meeting, so to talk about this more. So we can, maybe after the meeting, you can show me exactly on these 2 that we're proposing, what you're suggesting. I will say on the new cases, data that we've been using, we're actually using half of what was recommended by experts across the country, so I felt like we've already been pretty, yeah. And I mean, we have 4 of our 6 counties are in gray, like that's our lowest level. That's really great. We've made really good progress. And so, anyway, so I can, bring that back and reconsider that for our special meeting. And regarding the elected officials input, I'll just say, it's been a long time, but I would, well, our team is still, I'm not doing it as often, but meeting with county emergency managers, and that was our primary avenue, seeking input through them to us, with the exception of mayors who are often reaching out to me directly, and legislators. That certainly agreed that could be, could have been or could be, if we wanted to keep it.
I will say that changing these changes, delaying these changes doesn't help the color categories that we get listed in. And so knowing that we are still gonna have an opportunity to have another meeting to address them, I don't think that we should pass on the opportunity today to make a change to the levels.
Yes.
Is there a second on that?
Well, I would like to second it, but I would like to make further changes. Is there no reason why we can't do that as a board right now? And go closer to what Carrie is suggesting versus what we have now? Isn't that our job?
Yes.
Wouldn't it be more prudent to do that at this special meeting,
No.
where we can sit down and discuss how we want to move forward?
If I might weigh in, this Commissioner Hannigan, I like the fact that
rescind it.
I guess it depends on how quickly you wanna have that special meeting.
Today.
Next week. Yeah.
Maybe we can have it this week, because we need to give notice as long as we can meet. The law, well, I will say Commissioner Elliott is having a procedure done this week, so.
Next week is too late.
We want it to be included in the meeting. I have to take that into consideration.
And I would appreciate Brian being able to be part of his too.
Yeah, next week would be good.
I would respectfully ask that we wait until next week, please, so I can be back in Idaho, so I can be there in person.
Then I want changes, obviously, but I would like to move, at least in the right direction. So I would support these changes to be implemented immediately, that were recommended by staff.
That motion,
Yes.
I will second.
We already had a motion and a second on the floor,
We had a second.
so if you wanna move forward,
Oh, yeah, that's true. She did second.
so we need to either, rescind that or make a vote on that right now.
Commissioner Berger, are you good with the motion just as recommended at this time?
Yes.
Okay.
So that one has been rescinded.
Nope, we were agreeing that it's still valid and on, up for vote.
Okay.
The changes
With no change, with as recommended.
as recommended.
Yeah.
Now, this is on the first,
Which is as written.
Well, I don't think.
I just asked, for a little bit more discussion, so that's what we got, thank you. And I seconded the original motion.
okay. Well, then on the motion on the floor, is a first, motion and a second, all those in favor?
Aye.
Aye.
Aye. Motion carries. Next on the agenda is the February 2021 expenditure and revenue report, and that's Troy.
Good morning, everyone. I will kind of reflect our